We've established that learning involves change, and detecting change requires measurement. I like to think of these measurements as academic and behavioral vital signs. Annual physical checkups help to detect health problems early and prevent serious illness. Our annual physical always begins with screening our vital signs to tell our doctor if we're healthy. Just as our temperature, pulse, respiration rate, and blood pressure tell our doctor if we're healthy, criterion referenced measurements can tell our teachers if we're at risk academically or behaviorally. When we find a medical concern, one of the first actions our physician takes is to measure our vital signs to assess the health of our basic physical systems. Only after measuring these vital indicators and asking more questions does our physician form a hypothesis about what's causing our reported problem. From this hypothesis, additional tests are requested to confirm the problem, and then a treatment plan is conceived. Criterion-based measures of academic skills and the behavior patterns allow for the development of good hypotheses and the scientific examination of reported academic and behavior concerns. Curriculum could be defined most simply as what you teach. Expanding the definition slightly, we might include the concepts of scope and sequence to indicate that there are boundaries and sequences to curriculum. Finally, we might want to include how you might teach as an important element of our definition. Using this definition, it's easy to see that curriculum is readily described by criterion-referenced measures. For any topic we are teaching, there is a beginning and an end, or a scope, to the skills expected from the group of learners. The tasks within the scope are the criterion that can be used as references for learner performance within the curriculum. We can measure student performance of those tasks within the curriculum and determine if they have acquired the required criterion level of performance. Collecting information about student skills within a curriculum can take three forms. First, we can determine what the student's current level or performance is against an expected criterion in the curriculum. This is called benchmarking. Benchmarking tells if a student's performance is adequate or if the student is at risk. Benchmarking is a screening procedure that supports early intervention practices. Benchmarking should be conducted for all students at least 3 times a year. Second, we can use student screening data, benchmark scores, and research-based expectations for growth from sources like Ames Webb, Dibbles, Dino, Fuchs, Marston, and Shin, Fuchs, Hamlet, Waltz, and German, or Hasbrook and Tyndall, to establish individualized learning goals. Third, we can monitor student learning to ensure adequate progress toward those selected goals and use that information to make database decisions about instructional modifications. Formative assessment is using data collected during instruction to make database decisions about the instruction before the instruction is complete. This offers us opportunities to adjust instruction and improve the probability of goal achievement. Summative assessment is using data collected at the end of the instruction in order to determine if the goal was achieved. Let's consider both of these models of assessment in an analog model. If we think of instruction within a curriculum as a road trip, we might plan a trip from Shreveport, Louisiana to Fort Worth, Texas to visit the zoo. We want to arrive in time to see the keepers feed the big cats at noon. We have a beginning benchmark, an end goal, and time, which is our instructional parameter. Both models require the same initial information. I used a measurement tool, MapQuest, to collect some data. There are 2 instructional paths I might follow, US 20 West or US 80 West. Both routes are the same length, or have the same scope, 224 miles. However, US 20 West will take 3 hours and 33 minutes, and US 80 West will take 4 hours and 19 minutes. Since we have a time parameter involved with our goal, I select US Route 20 West and determine that I need to depart by 8 a.m. to arrive in time for the noon feeding. If we apply formative assessment concepts to our trip, we could plan our goal of a noon arrival at the Big Cats exhibit and make en-route measurements of time and distance to support our decisions about stops and other events, ensuring that we meet our goal. We might be able to make an extra pit stop if we are making more than adequate progress, Or we might need to speed up or skip a planned pit stop if we're not making adequate progress toward our goal. Formative assessment empowers us to make good decisions about achieving our goals. If we apply summative assessment concepts to our trip, we could plan our goal for a noon arrival at the Big Cat exhibit and begin our trip. According to our input parameters, we will arrive on time if we depart at 8 o'clock and drive the speed limit. Our next planned measurement is as we walk up to the Big Cat's exhibit. Will we be on time? According to our plans, yes. The risk is that we don't know the answer until it's too late to make any speed, stop, or route changes. Summative assessment tells us that we are successful or not, but it does not afford us the opportunity to improve our success rate. What are some of the characteristics of curriculum-based measurement that make it different from norm-referenced assessments? Well, first, CBM is brief. CBM measures take just a few minutes to complete as opposed to an hour and a half for your typical norm-referenced test. CBM is low inference. It's aligned to instructional outcomes, so your testing skills directly represented in the curriculum. CBM targets alterable variables, things you can teach. You know what a student can and cannot do, not just how the student fits into a distribution. CBM is low bias. Performance of specific academic skills is measured against the skill, not against other students, so bias is not introduced. CBM is sensitive. It detects small changes in performance on alterable variables, things that you can change through instruction. It allows us to see smaller units of progress than standard teacher-made test or norm-referenced test. And finally, CBM is repeatable. It's easy to generate multiple equivalent formats for frequent administration. Norm-referenced tests should not be administered more than every 12 months, making them useless for monitoring and managing growth. Finally, CBM is not a curriculum. It's a tool that may be used with any curriculum. CBM helps us to document what a student can do, target instruction and tasks that students cannot do, and monitor the effectiveness of learning and instruction to explain all of this in clear, simple terms without edutalk or psychobabble. Some of the strengths of CBM include being aligned with teaching in the curriculum. CBM is tasking actual skills, not hypothetical outcomes of skills. It targets alterable variables. Alterable variables, again, are things that we can change through instruction. So it's tied closely to changing student outcomes. It's diagnostic. It provides information about a student's specific performance and needs within a curriculum, not just descriptive as a norm reference test would be. And it can be used in an idiosyncratic model. It gives us information about the student's skills and progress compared to that of their past performance. So in this model, curriculum-based measures allow us to measure learning. There are three types of CBM measures: general outcome measures, which are holistic or capstone measures; skills-based measures, which look at discrete subskills or skills where there are no capstone measures possible; and mastery measures, which are very atomistic. These are looking at very small, finite pieces of instructional material or skill. General outcome measures are holistic or capstone examples. These would be samples of complex skills like reading that require a number of subskills. Their strengths include reducing the number of different measures required to keep adequate information about a student, assessing subskills in the context in which they're used instead of out of context, and supporting screening and progress monitoring of student performance. They have a drawback, and that is that they are general measures. Skills-based measures are samples of skills, for example, math, where there's no capstone skill, but a list of specific skills. The strength here is that skills-based measures support screening, progress monitoring, and survey-level assessment. But because they're broad in scope, when we test them early in instruction, very few of the items will be relevant to the student, and therefore limited numbers of items are sampled and a limited amount of inference or decision-making can be done. And finally, mastery measures are very atomistic. These are samples of specific skills, things like punctuation, letter sounds, single-digit addition without regrouping. Like skills-based assessment, but narrower samples of skills. The strength is that they support screening, progress monitoring, and survey level assessment. Their weakness is that their narrow focus does not support general performance assessment or progress monitoring of long-term goals. Haas, Posp, and Howell included this table in your textbook. It's a useful source for being able to see the types, uses, structures, advantages, and disadvantages of each of these three types of CBM measures. We use CBM for data-based decision-making. When I talk about data-based decision-making, I'm talking about solving academic and behavioral problems using the scientific method. CBM is the only suitable measurement system for such models. You cannot do this with norm reference test. CBM supports four major types of decisions. It supports decisions about screening, supports decisions about progress monitoring, it supports information about diagnostics, and it provides outcome level measurement of student performance. In database decision making, we follow a problem-solving model that looks like this. We identify the problem using curriculum-based measures and evidence-based criterion. We try to state our problem in terms of a discrepancy between what we currently observe and what we would like to observe. So an example of a problem stated for database decision-making using curriculum-based measurement would be Mike is a second grade student who is reading at 20 words correct per minute on grade level material. Second grade students should read 40 words correct per minute on second grade reading material. Therefore, Mike is reading 20 words correct per minute slower than expected. Then we move to problem analysis. This is hypothesis generation. This is the hardest part of the problem-solving model because we have to generate and test good hypotheses in order to understand why Mike is not reading adequately. There are some great articles for this. One that we always start to teach this from talks about 5 common reasons that students are not successful. And these include that the student doesn't want to do it, that the student hasn't done this enough to be good at it yet, they haven't had enough practice, that the student hasn't done it this way before, that the student hasn't had enough help learning how to do this, or that the student simply can't do it, it's too hard. Those are all hypotheses, and each of those hypotheses could be tested quickly in a model that we call brief experimental analysis to determine which one was probably the reason why we had a problem of Mike reading too slowly. Once we identify the probable reason through hypothesis testing, then we can move to intervention. We can select evidence-based instructional practices that match precisely the reason why Mike is not reading fluently, instead of simply taking a wild guess at it or applying a generic standard intervention to all reading problems. And of course, this fourth element then is evaluation, and here we're talking about formative evaluation, also called in this model progress monitoring, where we are constantly collecting data, frequently collecting data on the outcomes of Mike's reading fluency as he progresses in the intervention selected as a result of the problem analysis. If Mike is making improvements, then we continue our treatment. If Mike is not making improvements, we evaluate our analyses and determine what the next most probable, least intrusive treatment might be, and maybe make a shift in that. There are several things we can change there. So this use of this database decision-making model is going to be a whole module in itself, but I wanted to introduce it at this point so that it was clear why we would collect this kind of information and what kind of model we might use it in. All right, so now you've had an overview of curriculum-based measurements. What are they and why do we use them? Now we're going to introduce you to some modules on how do we do curriculum-based measurement for reading, how do we do curriculum-based measurement for writing, how do we do curriculum-based measurement for math, and then finally we'll have an expanded model on this module on this database decision-making model. And that will make up our unit on measuring learning.